Namaste. I am naga Simhadri, founder, MD, and CEO of the Shubakrut Medical Genetics Private Limited. We are offering personalized genetic testing with insights that can impact your health and wellness. We can help you take proactive steps with your genetics to reduce the risk of developing disease like cancer, Parkinson, Alzheimer's, and any more. Shubakrut Medical Genetics, it's like a predictive and preventive and treat diseases like precision or personalized medicine healthcare services and significance of DNA test or genetic testing. Your genes can reveal structural, functional, and environmental information about you. They are about health and diseases. So, at any age, you should be aware of your genes. DNA testing can detect genetic, chromosomal, and protein mutations. These mutations can reveal whether or not you have a genetic condition. A DNA test can also predict your chances of developing a disease or passing a genetic disorder onto your children. A sample of your blood, skin, hair, tissue, or amniotic fluid is collected for genetic testing. A DNA test can reveal a wealth of information about the genes that make you who you are. Gene test look at your genes or DNA to see if there are any changes like mutations that could cause or increase your risk of developing a genetic disorder. Gene test can look at a single gene, a few genes, or your entire genome. Chromosomal tests look at your chromosomes. They search for changes in gene order that could be the source of a genetic condition. The number of chromosomes is one of the changes that investigators look for. Protein tests look for the byproducts of chemical reactions in our cells by analyzing enzyme activity in cells. Protein problems may indicate that you have changes in your DNA that are causing a genetic condition. There are important testings we provide, like carrier testing. When a condition is autosomal recessive, it means that someone can carry the gene for it but not experience the important testings we provide, like carrier testing. When a condition is autosomal recessive, it means that someone can carry the gene for it but not experience symptoms. Carrier testing can determine whether you have a copy of a mutated gene for an autosomal recessive disease. This is usually done because one patient is family or one parent's family has a history of a disease that is autosomal recessive, which means it requires a copy of the gene from each parent. So, if one parent knows they have an autosomal recessive gene, the other should be tested to determine the risk of passing the disease onto their children. Next testing, prenatal testing. A prenatal DNA test can detect mutations in your developing baby's genes or chromosomes while you are pregnant. Prenatal testing does not screen for all possible conditions. However, it can influence your baby's chances of being born with certain conditions that we are aware of. If your baby is at a higher risk of having a genetic condition due to the family's genetic history, your healthcare provider may recommend prenatal testing. Next test is it is like screening, pre-implantation genetic screening. We are doing screening test like pre-implantation genetic screening. Pre-implantation testing can detect genetic mutations in embryos created using assisted reproductive techniques ART, such as in vitro fertilization IVF. A small number of cells are extracted from your embryos and tested for mutations. Only embryos free of these mutations are implanted in your uterus in an attempt to start a pregnancy. Newborn screening. 2 days after birth, your newborn will be tested. A newborn screening examines a baby for genetic, metabolic, or hormonal abnormalities. Newborns are screened shortly after birth so that treatment can begin as soon as possible if necessary. Next, testing for diagnostic purposes. Diagnostic testing can confirm or rule out specific genetic diseases or used during pregnancy, but it can be used at any time to confirm a diagnosis if you have symptoms of a specific disease. We are offering a very important testing like predictive and prognostic testing. Predictive and pre-sympathetic testing can detect gene mutations that increase your risk of developing a genetic conditions later in your life by looking for chances in your genes that increase your risk of developing certain diseases. Certain types of cancer are among them. Pre-symptomatic testing can predict whether you will develop a genetic disorder before you show any symptoms. Next, pharmacogenetics. Pharmacogenetics is an important example of precision medicine, which aims to tailor medical treatment to each individual or group of individuals. Pharmacogenomics studies how your DNA influence how you respond to drugs. In some cases, your DNA can influence whether you have a bad reaction to a drug or whether it helps or does not help you. Pharmacogenomics can help you improve your health by predicting whether a drug will benefit you and safe for you to take. Genetic testing risk. Most genetic tests pose minimal physical risk. Prenatal genetic testing does carry a small risk of miscarriage. This is due to the fact that the test requires a sample of amniotic fluid from your developing baby. The most significant risk of genetic testing are emotional and financial. You may feel angry, scared, depressed, and anxious or guilty if you receive unexpected results. Furthermore, genetic testing can range in price from thousands to lakhs of rupees. Usually, genetic testing looks for changes in your DNA, which are sometimes referred to as mutations or variants. Genetic testing is useful in many areas of medicine and can influence the medical care you or a family members receives. There are many different types of genetic tests and results are usually available within a few weeks because you share DNA with your family members. If you are found to have a genetic change, your family members may also have the same change. Yeah, Shubakrut Medical Genetics is located in Health City, Vishakhapatnam. It's near to Simhachalam Hills. It's generally Shubakrut Medical Genetics is treating like healthy people and patients. It's like who are already have disease, like it's comes under like diagnostic testing and all. And the person who are want to know their future conditions, it's like prognostic. So we are collecting like blood sample or buccal swab or amniotic fluid from female who are pregnant. Yeah, our office contact number is 0891 and my personal number is 8978328127 and 630342958. And you can mail me md or ceo at the rate of shubakutmedicalgenetics.com.